Hello friends, this is Dr. Ritvi. Welcome to Homoeopathy the Healing Power. Friends, in today's video, we are going to study the remedy which has very limited sphere of action, but to the point indications. This is a little known but a well-known remedy for respiratory diseases. Once given when indicated in your patient, it relieves all the distressing symptoms of your patient instantly and gives magical relief to your patient. That is why this remedy has a very great value in respiratory diseases. So friends, I am talking about none other than Sticta Pulmonaria, a little known but a well-known remedy for respiratory diseases. So friends, without any further delay, let's start in detail study of this remedy Sticta Pulmonaria. But before that, if you are new to our channel and if you have not subscribed our channel till now, then subscribe the channel, press the bell icon and select option all so that you will get notified whenever a new video is uploaded from Homoeopathy the Healing Power. As well as give this video a like and share this video among homeopathic students and new practitioners. So let's get started. Sticta Pulmonaria. This remedy is commonly called as lungwood. Sticta is one of the type of lichen, and this lichen is found growing on the trunks of the large trees found in the northern mountain countries of England and in United States. This lichen is later collected, mixed with alcohol, and the mother tincture is prepared. Later, the upcoming potencies are prepared from it. Friends, as discussed earlier, that this remedy has a great affinity towards respiratory system. It also has a great affinity towards the extremities. That is why this remedy acts well on the extremities, especially acts well for the rheumatic cases. That is the reason this remedy has very limited indications, so it has very great therapeutic value in our practice. It has its unique keynotes for its clinical cases whenever it is indicated. And on the basis of symptom similarity, whenever prescribed, it instantly relieves the pain in rheumatism and it instantly relieves the nagging and the obstinate symptoms of respiratory diseases. So friends, one by one, let's see the keynote feature of this remedy. Starting first with the rheumatism. Sticta pulmonaria is specially indicated for rheumatism of right shoulder joint, of wrist joint, and also of ankle and of knee joints. So friends, we should not think this as a chronic remedy or a remedy for a very chronic rheumatism. But this remedy is also indicated for acute rheumatism whenever we see an acute inflammation in the joints affected. As it is one of the catarrhal remedy, so inflammation is also most important symptom of this remedy. So here in acute rheumatism, we will see heat, swelling and circumscribed redness of the affected joint. The most important symptom of this remedy is that the rheumatic pains, if seen in the right shoulder joint, extends towards deltoid and biceps of the same hand, of the same side. There will be swelling, heat and redness of the joint, as well as we can see an inflammation and redness specifically seen over the affected joint. The pains seen in this patient are very severe and are very drawing in nature. Along with severe shooting pains, we see that the neighboring tissues, the neighboring muscles of the joint also become swollen and painful. Sticta is also well indicated remedy for housemate's knee. Chorea-like spasm are also seen along with rheumatic complaints in Sticta patient. As well as most important sensation is seen in this patient. They feel as if their legs are floating in the air. So along with rheumatism, if you find this symptom, then you should go for Sticta pulmonaria. Most of the time, it is also seen that rheumatic stiffness of neck is also seen in this patient. So that is why this remedy also works great for cervical spondylitis. Friends, now let's see the respiratory symptoms of Sticta Pulmonaria. Whatever may be the disease, it may be coryza, a simple cold coryza, a cough, pneumonia, asthma, or rhinitis, whatever may be the name of the disease. The symptoms which we are going to study today are only important for a prescription. And when you find this symptom in your patient for any of the respiratory disease, you can go for Sticta Pulmonaria. Sticta Pulmonaria is specifically known for its strictly dry coryza. As we all know, coryza means running nose, lacrimation, heavy acrid or blunt type of lacrimation and running nose. But in Sticta, there is a dry coryza. This dryness produces excessive pain in the mucous membrane. So this excessive dry coryza with very pain seen in the mucous membrane is not because of lack of secretion. It is because of the secretion which dries up very rapidly and which leaves a thick crust behind. So there is a dryness of nasal membrane, and due to which the patient constantly blows the nose, but no discharge is seen. Again, this is the keynote feature of Sticta. So as we have discussed the important keynote earlier, that there is no lack of secretion, but the secretion dries up quickly, leaving a thick crust behind. So because of this, it is seen that the buccal cavity of the patient and especially the throat becomes very dry, parched and looks like a leather. And because of this dry hardness of this dried secretion, the patient is unable to sleep. And he sits up all the night. Sits up, sneezes and coughs. Sneezes and coughs. So there is a constant sneezing and coughing seen. Towards the morning, the palate and the throat of the patient gets little bit moistened. And then the patient is able to sleep. So this is again the important keynote symptom of the patient of the Sticta Pulmonaria in the respiratory diseases, that the patient is unable to sleep the whole night because of the distressing cough and the sneezing. And then it is only in the early hours of the morning the patient feels sleepy and is able to sleep. So similarly, here Sticta is well indicated remedy for dry hacking cough, especially seen at night, which again gets worse on inspiration. So here again the throat is raw, there is dryness of mucous membrane again seen, the secretion escapes, dries up quickly, and here the loose cough is especially seen in the morning. So along with the cough, the patient also suffers from the pain. The pain is felt through the chest from the sternum to the spinal column. Especially Sticta Pulmonaria is indicated when the cough is seen after the measles. Again, this is the PQRS symptom of Sticta. Specifically, this type of the symptom can be seen in children. The cough is worse towards evening, and when the patient feels more tired, more the cough is felt. Also, the pulsation is felt from the right side of the sternum down to the abdomen during cough. Considering this important keynote symptom of Sticta, that is the great dryness at night and secretion seen during the day, this remedy is considered as a therapeutic remedy for allergic rhinitis, that is for hay fever. So at night it is seen that the discharges almost gets stopped, and whatever may be discharged have seen dries up quickly, and the air passage later becomes very dry. The patient suffers from recurrent sneezing, frequent sneezing, and sneeze and cough is seen so much that makes the patient very difficult to sleep. It's only in the early hours of the morning a little bit of discharge is seen which moisten up the air passage, and now the patient is able to sleep. So which is again followed by profuse discharge from eyes and nose, which is hot and excruciating, causes the affected area to become very raw and sore. So especially the area from which the discharges flows like cheeks, borders of nose and upper lip become very raw and sore. So these discharges are generally seen at time of sunrise. So most of the time Sticta is well indicated remedy for symptoms like coryza, bronchial catarrh, influenza, cough or any type of respiratory diseases. Also it is indicated well when along with the respiratory diseases, rheumatic complaints are seen together in one patient. The patient here is very dull, malaise and tired all the time. Dull, heavy pressure is felt in the forehead. Sometimes the patient even suffers from catarrhal conjunctivitis. If we look at the mild symptoms of Sticta, it is seen that these patients are very talkative. They always want to talk all the time. Along with this heavy talkativeness, it is seen that there is a confusion of ideas. And again, one symptom which discussed earlier is that the patient feels as if floating in the air, especially the lower extremities are felt by the patient that they are floating in the air. This is again the most important symptom of this remedy. All of the symptoms are worse during sudden changes in the temperature, and especially the patient suffers more in the cold temperature. So whenever the cold is coming, the symptoms are seen aggravated in the patient. So friends, this is all about Sticta Pulmonaria. Please leave your valuable feedback and any suggestion in the comment section given below. Like this video and share this video. Subscribe the channel to meet again. Thank you for watching.